Hello, everyone. Welcome to today's deep dive. I am your host, registered nurse Anu Nupane, with 15 years of experience in the medical field. Today, we're embarking on a pretty fascinating medical journey to really understand one of the most common, yet literally one of the most dangerous conditions out there. Let's just jump right into it. So, hypertension. It's famously known across the medical community as the silent killer. And, well, why is that? It's kind of like a silent detective's worst nightmare, right? It's this mystery killer that quietly and relentlessly damages your blood vessels without you even having a clue. Honestly, you could feel perfectly fine just walking around every day while it's secretly wreaking absolute havoc inside your body. Here is our agenda for this explainer. We'll be looking at 1. Blood pressure basics and classification. 2. Primary versus secondary causes. 3. The RAS pathophysiology. 4. Symptoms of the silent killer. And finally, 5. Medical and lifestyle management. Let's keep moving. Starting off with Section 1, blood pressure basics and classification. Okay, so what exactly is blood pressure? Put simply, it's just the physical force your circulating blood exerts against the walls of your arteries. We measure this using 2 numbers. That top number, that's your systolic pressure, the high pressure phase when your heart's left ventricle forcefully pumps blood out. A normal baseline here is under 120 millimeters of mercury. The bottom number is diastolic. This is the resting phase, those tiny milliseconds when the heart actually relaxes and refills between beats. That should normally be under 80. Now, looking at the AHA and ACC guidelines, notice the exact criteria for diagnosing how severe it is. For stage 2 hypertension, you're looking at readings of 140/90 or higher. But, and this is a huge medical catch, a doctor isn't going to diagnose you based on just one single reading. Like if you just ran up a flight of stairs or had a super stressful day. That doesn't count. It requires these elevated readings on 2 or more separate occasions taken while you are completely relaxed. Which brings us to Section 2, primary versus secondary causes. There are basically 2 distinct pathways, or suspects, that lead to elevated blood pressure. Here's the main difference. Primary hypertension is gradual. We don't really know the exact single cause, but it's heavily tied to your lifestyle and genetics. It develops slowly and makes up a massive 90 to 95% of all cases. Secondary hypertension, on the flip side, is totally different. It's sudden, and it is caused by a specific, known underlying disease. Let's look at the primary risk factors. We've got genetics, not moving enough, high stress, obesity, and crucially, tobacco, alcohol, and high-fat diets. When you eat a high-fat diet for years, fats physically deposit inside your arteries, creating plaques. This is a process called atherosclerosis. Your blood vessels become narrow, they get stiff and lose elasticity. So your heart has to pump so much harder just to squeeze the blood through, which drives that pressure straight up. Secondary causes are more like structural or chemical blockers. We're talking about the physical narrowing of the renal artery, tumors on the adrenal gland, structural issues like coarctation of the aorta, pregnancy complications like preeclampsia, or even just everyday medications like oral contraceptives and standard painkillers. The really good news here? If you fix that underlying issue, like treating the kidney problem or stopping that medication, you can often completely resolve the high blood pressure. All right, Section 3. The RAS Pathophysiology Explained. Okay, buckle up because this is where the crime scene gets really fascinating. This is how the body's desperate attempt to save itself actually backfires. The renin-angiotensin-aldosterone system, or ROS, is this massive domino effect inside your body. Imagine your kidneys aren't getting enough blood flow. They literally panic and release an enzyme called renin. Renin acts on a liver protein to create angiotensin 1. Then, as it passes through your lungs, it converts into angiotensin 2, which is a super potent vasoconstrictor. That triggers your adrenal glands to release aldosterone, forcing your body to hoard sodium and water. The result? Your blood volume expands, your vessels squeeze incredibly tight, and your blood pressure absolutely skyrockets. Moving on to Section 4, symptoms of the silent killer. We really need to remember why it earned that terrifying nickname. Symptoms do eventually exist, but here's the scary part. They usually only show up when the pressure is already at critically dangerous severe levels. We're talking severe headaches, epistaxis, which is just a fancy word for sudden nosebleeds, blurred vision, intense fatigue, confusion, and chest pain. This happens because that intense pressure is actively bursting the extremely fragile blood vessels in delicate places like your eyes and your nasal cavity. So what happens if we just ignore it? The long-term stress of your heart constantly pumping against that high resistance physically thickens the heart muscle itself, leading to left ventricular hypertrophy and eventually a heart attack. That relentless high pressure also violently ruptures tiny vessels in your brain, causing a stroke, in your kidneys causing renal failure, and in your eyes causing retinopathy. It is just a total systemic breakdown of your organs. Finally, Section 5, Medical and Lifestyle Management. Fortunately, we can fight back. We have incredible pharmacological tools at our disposal. Diuretics, like furosemide, act like water pills, physically flushing excess sodium and fluid out through your urine to lower your blood volume. Beta blockers, like metoprolol, calm the heart down so it beats slower and with much less force. ACE inhibitors, like captopril, directly block that crazy Ross domino effect we just talked about. And calcium channel blockers, like nifedipine, forcefully relax the muscle cells in your blood vessels, opening them up wide to relieve the pressure. But remember, you guys, medications alone are not some magic bullet. They absolutely must be paired with immediate lifestyle modifications for long-term survival. You have to adopt a healthy diet, like the DASH diet, drastically slash your sodium intake, get up and exercise regularly to reduce that vascular resistance, and absolutely, 100%, quit smoking. These everyday choices are literally your strongest armor. Which brings me to a question I want you to seriously ask yourself today. Is your daily routine silently feeding the silent killer? Or are you actively taking steps to protect your vessels? Your baseline health is entirely in your hands, and the absolute best time to start making positive changes is right now. If you enjoy this explainer, don't forget to like, comment, share, and subscribe to our channel for more amazing content. Your support helps us grow and create better explainers for you. Thank you for watching.